So with me now are Stephanie Lange, Student Assistance Specialist at Dakota High School, who has developed a successful program for suicide prevention, and also Barb Smith, Executive Director of the Barb Smith Suicide Resource and Response Network, which provides evidence-based training on suicide prevention. Stephanie, I want to start with you. Tell us about the work you're doing at Dakota. What's this program about?
So our program really just consists of a combination of classroom lesson plans. So we're trying to deliver a lesson about suicide prevention or mental health awareness to every student every year, along with assemblies for students and also training teachers and staff to be aware of mental health concerns that students might be facing.
What makes it effective?
Well, I feel that what makes it effective, the most effective, is that we're training students to be like the front line, to be able to identify when something's going on with a friend instead of 100% relying on adults being able to identify it, because we feel like they're going to notice something in a friend probably much sooner than an adult would notice it in a student.
What about the work you do?
Well, we do and offer prevention and aftercare specialties. So what we do is we offer the evidence-based as well as awareness trainings to go out into the public, and we say where people live, work, learn, and play. So we deliver trainings that help teach you the tools, just like you would for if you're on fire, stop, drop, and roll. We want simple yet effective tools of how to recognize someone with thoughts of suicide and how to respond in a life-saving way. And then we also offer aftercare trainings as well as services for those who have lost someone to suicide.
What does that mean when you say evidence-based?
That means that it's been highly evaluated to show a behavior change over years, over a series of times with multiple people at multiple levels. So meaning that it's been recognized and that it's proven to work.
Yeah, what do you think makes some approaches work and some not?
Well, I think it's what people are ready and willing to do, and what they, we say one size doesn't fit all, number one. And I feel like when people are ready and willing and able, but if they're taught a tool that's very simple, they're more likely to use it.
When you see these kids that you work with at Dakota, and you've seen them through the years, what do you think is going on that makes them more vulnerable to anxiety and to depression?
So we were just talking about this in the previous session. So my opinion is that students have always experienced a certain degree of anxiety and depression, and it's just in the last maybe 5 to 10 years where adults have given them permission to talk openly about this. So I don't necessarily feel like it's a higher level. I feel like it's a heightened awareness and a comfort level. We're telling students to speak up, so they are. And so I feel like that's something that I feel in my population, in my building. That's my opinion.
Do you think we, in our generations, as we were growing up, it was happening around us, but we just didn't know, or if we felt it, we didn't know what to call it?
I think it's the pressures people have now, more so.
More so.
You know, we didn't have the pressures of being the number one in the class and the strongest athlete. And I heard a speaker say recently, we're so busy doing that we're not just being. So there's no relaxed time. There's always some type of adrenaline going, or
there's an
anxious.
expectation to be busy. There's an expectation to be producing something. I definitely agree with that.
Yeah. So there's never, your body and your mind's never calming. And I feel like we need to kind of go back to let's just be.
So there is so much work to be done.
Yeah.
It's really complicated. The issue is really complicated, and I know that my population in my building is a unique population. It's different than maybe other schools across the state.
Yeah.
That's why I don't want to say to like
Sure.
extrapolate that to all of Michigan. So it's just a complicated issue, and I think the more people working together with resources is how we're going to make the biggest impact.
And talking about it,
Yeah.
just
Yes.
like we're doing.
Yeah.
Thanks to both of you for being with us.